12 Early Signs of Diabetes, recognizing the symptoms for early detection and management. Did you know that over 60% of adults may be living with insulin resistance without realizing it? The silent first step towards diabetes? This disease not only affects the heart, eyes, and brain, but is also a leading cause of premature death worldwide. In today's video, I will help you identify 12 early signs of diabetes, the warnings your body is sending, so you can take action and protect your health. Don't ignore any sign, as even the smallest one can completely change your life. 1. Acanthosis nigricans. This condition is characterized by patches of darkened skin that may feel velvety smooth or slightly thicker than normal. It commonly appears in skin folds such as the neck, armpits, groin, and finger joints. Occasionally, it may also occur on the knees or elbows. Biological factors. Increased insulin levels. When your body struggles to process sugar efficiently, your pancreas releases more insulin to help move glucose into your cells. Insulin is an anabolic hormone, meaning it promotes growth. When insulin levels are high, it can stimulate skin cells to grow faster. Melanin accumulation. This rapid growth leads to new skin cells containing more melanin, the pigment responsible for skin color. This increased melanin concentration causes the affected area to appear darker than the surrounding skin. Insulin resistance and diabetes are closely linked. Acanthosis nigricans, a skin condition characterized by dark, velvety patches, is not a typical skin issue, but rather a sign that your body is struggling to regulate blood sugar and insulin. Individuals with this symptom have a higher risk of developing prediabetes or type 2 diabetes. The good news is that if detected early and addressed through lifestyle changes, such as reducing sugar and carbohydrate intake and improving insulin sensitivity, the darkened skin patches can lighten. 2. Sugar cravings. Individuals with insulin resistance or prediabetes often experience cravings for sugary foods, especially after meals. These cravings can arise suddenly, be difficult to control, and typically focus on high-sugar items like pastries, candy, or sugary drinks. Biological factors play a role in sugar cravings. Insulin resistance, where cells are unable to absorb glucose despite its presence in the bloodstream, can lead to a feeling of hunger. This is because the brain receives signals that the body is lacking energy, even though glucose levels are high. Similarly, consuming refined carbohydrates, such as white bread and sugary drinks, causes rapid spikes in blood sugar, prompting the body to release large amounts of insulin. This is followed by a sudden drop in blood sugar, leading to feelings of hunger and cravings for sweets to quickly replenish energy. Finally, the brain relies on glucose as its primary energy source. When cells are not absorbing enough glucose, the brain sends signals to stimulate appetite, particularly for sugary foods. A connection exists between sugar cravings and both prediabetes and diabetes. Early symptoms. Frequent sugar cravings can occur when your body begins to resist insulin, an early stage before developing type 2 diabetes. Long-term consequences. Continuously consuming large amounts of sugar to satisfy cravings can further increase insulin resistance, creating a vicious cycle. 3. Blurred vision. Blurred vision is characterized by difficulty focusing on details, with images appearing blurry or unclear. Associated symptoms may include red or bloodshot eyes, dry eyes, itching and burning, and difficulty maintaining focus during prolonged viewing. Biological causes. High blood glucose affects the lens. When blood sugar levels are elevated, excess glucose permeates the lens of the eye. Glucose draws water into the lens, causing it to swell and change shape. This change affects the lens's ability to focus light on the retina, leading to blurry vision. Eye blood vessel damage. Chronic high blood sugar damages the tiny blood vessels that supply blood to the retina. These blood vessels can leak or become blocked, causing a condition called diabetic retinopathy. This can lead to vision loss and even blindness if left untreated. Insulin resistance. In the stage of insulin resistance, the body's cells are unable to absorb glucose. This causes the brain and eyes to lack energy, leading to impaired vision. Blurred vision is one of the early signs of prediabetes or undiagnosed diabetes. If left unchecked, this condition can progress to chronic eye diseases such as glaucoma or cataracts. Blurred vision not only affects your eyesight, but also indicates damage to blood vessels throughout your body. 4. Frequent urination at night. Frequent urination at night, often more than twice, can disrupt sleep. This symptom is often accompanied by an unusual thirst, particularly at night. You may also experience increased urine volume each time you urinate. Difficulty controlling urination, especially in the later stages of prediabetes, can also occur. High blood glucose levels can lead to frequent urination due to several biological factors. When blood sugar levels are elevated, either due to insulin resistance or diabetes, the body attempts to eliminate excess sugar through urine. This glucose in the blood binds to water in the body, causing the kidneys to work harder to filter and excrete the sugar, resulting in increased urination. Prolonged high blood sugar levels can also put stress on the kidneys, potentially damaging the filtering units called nephrons. When the kidneys lose their ability to regulate sugar and water levels, the body may excrete more water, leading to frequent nighttime urination. Furthermore, high blood sugar can disrupt electrolyte balance. The high sugar content in urine causes the body to lose essential minerals like sodium and potassium, leading to thirst and increased fluid intake. This cycle can contribute to frequent urination. Frequent urination, especially at night, is an early sign of both prediabetes and type 2 diabetes. If left unchecked, this condition can progress to diabetic nephropathy, a serious decline in kidney function. Frequent nighttime urination can also disrupt sleep, leading to stress and impacting overall health. 5. Puffy face appearance. The face may appear swollen or puffy, particularly around the cheeks, eyes, and eyelids. Accompanying symptoms: dark circles or bags under the eyes may be present. The skin may feel taut or unusually smooth due to water retention. The swelling is typically painless but can be aesthetically unappealing. Biological causes: water retention due to high blood sugar. When blood sugar levels rise, glucose draws water from cells into the bloodstream to dissolve the excess sugar. This process increases the body's ability to retain water, especially in sensitive areas like the face, eyes, and eyelids. Insulin resistance. Insulin resistance makes the body unable to use glucose effectively, leading to fat accumulation and water retention, particularly in the face. Additionally, insulin fluctuations can trigger mild inflammation, making the face appear more swollen. High carbohydrate and sugar intake. Consuming too much sugar and refined carbohydrates causes significant fluctuations in blood sugar and insulin levels, leading to water retention. Some individuals notice a reduction in facial swelling after a few days of reducing sugar and carbohydrates from their diet. Kidney dysfunction. Prolonged high blood sugar puts stress on the kidneys, reducing their ability to filter and excrete water efficiently. Weak kidneys can lead to water retention in the face and eyes. The connection between prediabetes and diabetes. Early signs. Facial swelling can be an early indicator that your body is becoming resistant to insulin and experiencing glucose imbalances. Long-term consequences. If left unchecked, this condition can progress into type 2 diabetes and cause damage to other organs such as the kidneys, heart, and blood vessels. 6. Tingling and numbness. You may experience tingling, numbness, or a prickling sensation in your extremities, primarily your hands, fingers, feet, or toes. You might also feel burning, sharp pain, or a complete loss of sensation in these areas. In some cases, you may find it difficult to control your fingers or toes due to the loss of sensation. High blood sugar can damage blood vessels. When blood sugar levels are elevated, the small blood vessels, capillaries, that supply blood to nerves are damaged. This damage to capillaries leads to a reduced supply of oxygen and nutrients to the nerves, causing them to weaken or become damaged. Peripheral neuropathy. This condition occurs when peripheral nerves, especially in the hands and feet, are damaged due to prolonged high blood sugar levels. Damaged nerves send incorrect or interrupted signals to the brain, causing unusual sensations such as tingling, numbness, or pain. Accumulation of toxins due to insulin resistance. Insulin resistance disrupts the process of glucose utilization, leading to the accumulation of fat and toxins in the body, particularly in the nerves. This results in nerve inflammation, increasing pain, numbness, and loss of sensation. A connection between prediabetes and diabetes. Early signs of diabetes. Numbness and tingling are early warning signs of prediabetes or type 2 diabetes. This is a manifestation of diabetic neuropathy. Long-term consequences. If left unchecked, This condition can progress to complete loss of sensation in the hands or feet. Loss of sensation increases the risk of injury or infection that the patient may not be aware of, especially in the feet, leading to diabetic foot ulcers or even amputation. Skin tags. Skin tags are small, soft growths that are usually skin-colored or slightly brown. They appear on the surface of the skin and can range in size from very small, like a pinhead, to larger, a few millimeters. They are not painful, but can be irritating if they rub against clothing or jewelry. Common locations include the armpits, neck, chest area, especially in women, groin, and eyelids. High insulin levels in the blood can contribute to the development of skin tags. Insulin, a growth hormone, can stimulate rapid cell growth when insulin resistance is present. This accelerated growth can lead to the formation of skin tags, which are often considered a sign of insulin resistance and prediabetes. Inflammation and abnormal cell growth caused by insulin resistance can also contribute to the development of skin tags. This is because inflammation can trigger abnormal cell growth in the skin. Additionally, individuals who are overweight or obese may experience skin-on-skin friction in areas like the armpits, neck, or groin. This friction can create an environment conducive to the development of skin tags. The appearance of numerous skin tags can be an early warning sign of insulin resistance. This condition, if left unchecked, can progress to prediabetes and type 2 diabetes. It's important to remember that adopting a healthy lifestyle and diet can help prevent the development of these serious conditions. If insulin resistance is not addressed, it can lead to more severe complications associated with diabetes, including damage to blood vessels, nerves, and internal organs. 8. Sagging belly fat. Excess fat tends to accumulate primarily in the abdominal area, leading to a sagging appearance and affecting aesthetics. While overall weight gain may not be significant, the abdomen often appears larger than other areas of the body. Notably, abdominal fat can be firmer, visceral fat, or softer, subcutaneous fat. It's common to experience weight gain in the abdomen, even without overeating. Elevated glucose and insulin levels. When the body consumes excessive amounts of sugar or refined carbohydrates, blood sugar levels rise. To manage this excess glucose, the body produces more insulin. With elevated insulin levels, the body is unable to burn fat and instead stores it, particularly in the abdominal region. Insulin resistance. When cells become less responsive to insulin, the body is forced to convert excess glucose into fat for storage. This fat often accumulates around the abdomen as it is the body's preferred location for energy storage. Liver dysfunction. Excess blood sugar is converted into fat by the liver. When this process occurs continuously, fat accumulates in the liver and spills over into the abdominal area. This leads to fatty liver disease accompanied by visceral fat accumulation. Stress and the hormone cortisol. Prolonged stress increases the production of cortisol, a hormone that encourages fat storage in the abdominal area. Stress can also lead to overeating or unhealthy food choices, contributing to abdominal fat accumulation. Insulin resistance is a condition that can lead to prediabetes and type 2 diabetes. One of the most noticeable signs of insulin resistance is abdominal fat. Individuals with belly fat are at a higher risk of developing metabolic disorders, including diabetes, heart disease, and high blood pressure. It's important to understand that visceral fat, the fat stored deep within the abdomen, is not just a layer of fat. It acts as an endocrine organ, releasing inflammatory substances that can worsen insulin resistance. 9. Food coma. Feeling tired, sleepy, or sluggish after a meal, especially one rich in carbohydrates or sugar, is a common experience. This is sometimes referred to as a food coma. You may also experience difficulty concentrating, a feeling of heaviness, or a decrease in motivation. Some people may even feel the need to lie down or take a nap after eating. Insulin resistance occurs when your body's cells don't receive enough glucose from the blood to produce energy. As a result, glucose accumulates in the blood instead of being used effectively, leading to fatigue even after a full meal. Blood sugar fluctuations happen when meals high in carbohydrates or sugar cause a rapid spike in blood sugar levels. The body releases a large amount of insulin to lower blood sugar, but this can lead to reactive hypoglycemia, a state of rapid blood sugar decline after insulin takes effect. This can result in fatigue or sleepiness. Increased blood flow to the digestive system occurs after eating, as blood is prioritized to the stomach and intestines to aid digestion. This reduces blood flow to the brain and muscles, causing fatigue. Hormonal imbalances can occur when meals rich in sugar and carbohydrates stimulate the production of serotonin, a hormone associated with relaxation and sleepiness. The subsequent rapid drop in blood sugar also increases the hormone ghrelin, making the body feel low on energy. Feeling tired after meals could be an early sign of insulin resistance, indicating your body isn't processing sugar efficiently. This is a potential first step towards prediabetes or type 2 diabetes. If left unchecked, this condition can lead to several long-term consequences, including increased visceral fat around the abdomen, worsening insulin resistance, and an elevated risk of developing diabetes complications, such as damage to blood vessels and nerves. 10. Itchy skin. You may experience persistent itching on the surface of your skin, often in areas like your arms, legs, or hands. Your skin might feel dry and flaky, or you may notice red patches, though these are not always visible. Additionally, your skin may feel thin and easily irritated. Some people experience itching accompanied by small blisters or a burning sensation. High blood sugar levels can have a significant impact on your circulatory system, leading to various skin problems. When blood sugar is elevated, small blood vessels, capillaries, can become damaged, reducing blood flow to the skin. This can result in a lack of oxygen and nutrients, causing dryness and itchiness. Prolonged high blood sugar can also damage peripheral nerves, including those responsible for sensation in the skin. This damage can make the skin more sensitive and prone to itching. Furthermore, high blood sugar creates an environment conducive to bacterial and fungal growth, increasing the risk of skin infections such as folliculitis, fungal infections, or other dermatological conditions. These infections often cause intense itching and discomfort. Finally, high blood sugar can lead to a deficiency in vitamin B3, niacin, and other essential nutrients vital for maintaining skin health. A lack of niacin can cause inflammation, itching, and flaking of the skin. Early signs of diabetes. Itching skin is one of the warning signs that your blood sugar is not well controlled. This is a common symptom in the pre-diabetes stage. Long-term consequences. If left unchecked, this condition can progress to more serious complications such as peripheral neuropathy, diabetic skin conditions such as skin sclerosis or slow-healing ulcers, increased risk of skin infections. 11. Slow wound healing. Minor wounds such as scratches, cuts, or bruises may take longer than usual to heal. These wounds may be more prone to inflammation or infection, sometimes leading to the formation of difficult-to-heal ulcers. Accompanying signs include prolonged pain, redness, or swelling around the wound area. The skin surrounding the wound may become thin or easily damaged. High blood sugar can damage blood vessels, impairing blood flow to wounds. This can lead to delayed healing as the skin and tissues lack the necessary oxygen and nutrients for cell regeneration. Additionally, high blood sugar can weaken the immune system, making it harder for the body to fight off infections and wounds, further prolonging healing time. Nerve damage caused by high blood sugar can also reduce sensation in the affected area, making it difficult to detect minor injuries or infections, potentially worsening the wound before it is treated. Finally, the high glucose levels in the blood create an environment conducive to bacterial growth, increasing the risk of infection and hindering the healing process. Slow-healing wounds are a warning sign that your body may be struggling to control blood sugar and circulation. If left untreated, this can lead to serious complications. Chronic ulcers. These often occur on the feet and legs, particularly in people with diabetic neuropathy. Gangrene. Damaged tissue fails to regenerate, leading to tissue death and potentially amputation. Systemic infection. If an infection from a wound spreads, it can cause dangerous sepsis. 12. Brain fog. You may be experiencing difficulty concentrating, memory problems, or a feeling of mental fog. It might feel like your mind is heavy or fuzzy, making it hard to think clearly. You may also experience forgetfulness, disorientation, or an increased tendency to be distracted. These symptoms can be accompanied by mental fatigue and a lack of motivation. You might find it challenging to process information or make decisions. Occasionally, you may also experience mild dizziness or physical fatigue. Blood sugar fluctuations can significantly impact brain function. After consuming a meal rich in sugar or refined carbohydrates, blood sugar levels spike. The body responds by releasing a large amount of insulin, leading to reactive hypoglycemia, a sudden drop in blood sugar. This rapid decrease in blood sugar deprives the brain of essential energy, resulting in brain fog. Insulin resistance occurs when cells become unresponsive to insulin, preventing glucose from entering cells for energy production. This lack of energy in the brain can manifest as memory impairment, difficulty concentrating, and a feeling of mental emptiness. Chronic high blood sugar levels trigger the production of inflammatory substances, negatively affecting brain cells and their ability to connect. This chronic inflammation can impair cognitive function and lead to mental fatigue. High blood sugar levels also disrupt the balance of hormones like ghrelin and cortisol, contributing to feelings of fatigue and mental stress. This constant fluctuation in blood sugar levels ultimately reduces the brain's ability to process information and focus. Early warning sign. Brain fog can be an early warning sign of insulin resistance or prediabetes. Long-term consequences. If left unchecked, brain fog can progress to more serious issues like cognitive decline or Alzheimer's disease, sometimes referred to as type 3 diabetes due to its link to insulin resistance in the brain. Unstable blood sugar levels over time can damage blood vessels in the brain, impairing brain function. We've just explored 12 early signs of diabetes, important warnings your body sends. How many of these signs have you noticed in yourself? Don't panic, but consider this an opportunity for change. Diabetes isn't a death sentence. It's entirely preventable and manageable if you understand your body and take action today. If you found this video helpful, please like, subscribe, and share to help others recognize these potential signs. See you in the next video, where we'll delve into steps to reverse your risk of diabetes.